And people I don't know, welcome, and I think we're all in for a really exciting educational kind of evening. I'm Barry Burkhardt, Dr. Burkhardt, and it's nice to see all of you. We're going to have our physical therapist here tonight, who I'll introduce in just a minute. But before that, I did a little research to come up with some, I think, very interesting statistics about falling and gait and dysfunction. And a lot of these I kind of knew, but some of them were kind of like very revealing to me. I think what it shows is, it shows that people over 65 years old, 9,500 deaths are reported a year from falls. And that's considerable. In people over 75, half of those are the 9,500, or half of the 9,500. So as we get older, obviously the falls increase, and our risk of mortality and morbidity is even higher. The leading cause of death is from injury, and that's a big factor to think that people over 65 from injury, what's the cause of death is to fall, and that's pretty important. It increases our hospital stays. When we fall and injure ourselves and have to go in the hospital, it increases our hospital stays, doubles them, twice as long. And the big thing about that is afterward, it really affects your quality of living. You're independent. You came in independently living, and when you get out, the changes in your independent lifestyle changes dramatically. It shows that most of the falls are also females. Part of that can be, interestingly enough, vitamin D has become a big factor in everything in our lives and our diets and all that. And what we found is that vitamin D can be low in everybody, more so in women than men, but across the board, at least in my practice, I found that I would think 75% of my patients are deficient in vitamin D. And one of the studies they did on D is that they found people basically in nursing homes or in assisted living, things like this, if they were low in vitamin D, they fell much more than the people that had normal vitamin D levels. So that's why all the patients, we do D levels every year, and we find that supplemental D is a very big proponent in our office. 1/3 of people greater than 65 years old report a fall. That doesn't mean they necessarily injured themselves or they broke anything or whatever. But people 65 years and older, 1/3 of those people report a fall. And 2/3 of those people, if they reported a fall, will fall again within 6 months. So that's a huge number. When you talk about the big risk of falling, obviously, people on blood thinners too, by the way, that's the other thing. And a lot of people are on blood thinners, be that just an aspirin, or be that then going all the way to a Coumadin or one of our novel anticoagulants. People on blood thinners obviously are much higher risk for cerebral bleeds and head injuries. So we worry about that tremendously also. But the big thing obviously is hip fractures. And when you take a population of people from 65 to 69, 1 out of 200 people that fall have a hip fracture. When you take that up to 85 years old, it goes all the way down to 1 in 10. So that's how important that is, because what happens is people that report the falls and all that, within 6 months with fractures, they actually have an increased mortality rate, and that's within 6 months of falls. So I think it's important we address our awareness of our gait, of our function. We get dizziness. We have, I think falls occur, unfortunately, because we rush, we're not focusing, we get distracted. And I talked to a professional hiker the other day that said when she hikes and all that, and with different groups in Maine or here, what they stress is watch where you're going, and when you see something you want to see or like, you stop and look at it. So you don't keep walking and then gazing behind you or whatever. So I think we're going to be very enlightened to hear what we had tonight. And here's Christine Hayes and Stephanie Bean, both obviously registered physical therapists. They're right next to our office, known them for years, and I think you're going to find what they have to say very interesting and very knowledgeable. Christine, good. Okay, take care.
And welcome to all of you guys. We're very happy to be here to share our expertise and our knowledge in the realm of balance, not only with the older clientele that we see quite a bit of, but also, how balance affects the younger person as well, because we actually do both of that in our office. And one of the things that I wanted to say is, we see patients of all different types in our practice. And while our practice sees a lot of orthopedic patients from neck injuries all the way down to the foot and ankle, sometimes it's not apparent right out the gate that somebody has a balance issue, because they may come in for their shoulder, and it's obvious when they come in for an ankle injury or a knee, hip, or even the low back, that when we do our initial evaluations, a lot of times we see these balance issues right out the gate. And of course, then we treat them right out the gate, because we want everybody to recover in the best possible way. Some of the other orthopedic patients that we see, that it might be a little sneaky, but we're really finding the prevalence is really impressive. Where somebody might come in with a shoulder injury, and what Steph and I in the physical therapy practice that we do that's pretty unique is that once we evaluate somebody for the condition they come in with, a shoulder injury or what have you, once that condition's resolved, then we offer them something called a SFMA test, or a selective functional movement assessment. And so we're now looking at that individual from head to toe, and most of our patients jump right on that. They're like, yes, I want that functional movement assessment, because we don't just move in isolated patterns. We actually move in larger patterns, not isolated to one particular joint. So what affects one joint affects all the other joints. And so when somebody has a particular injury, we want to look at some of the other places where that dysfunctional movement pattern shows up. So when we do this SFMA testing in our sort of phase 2 rehab with all of our patients, it ends with a single leg balance exercise where we're assessing that balance, and it also ends with a squat. So it really highlights where these problems are, even in somebody who comes in the door for something else. So we see that in our orthopedic practice quite a bit. Additionally, we work with cancer patients, and we do cancer-related fatigue, we do lymphedema work, and believe it or not, the balance issues show up here in this population as well. It shows up from deconditioning, it shows up from chemotherapies. Some of the chemotherapies that create neuropathies can affect patients in their balance. And also if a patient develops lymphedema, even if it's in an arm or a leg where they have excessive swelling, that changes the way that they hold their body, the way the balance receptors are. So even in our cancer population, we're like on it. We're looking for, how can we help these folks also with their balance if there's an issue. Another area in our practice that one of my other physical therapists, not here tonight, Brooke Love, works is with pelvic floor patients, with pelvic floor incontinence in men and women, as well as pelvic floor pain. And one of the things that we see when Brooke does her evaluations is she's looking at the hip and the pelvis and the sacroiliac joint, and sometimes those balance issues start to show up in the work that she does. And certainly, as physical therapists, one of our screening questions that we ask patients that are having problems with balance is, do you have a problem with incontinence, where you have to run to get to the bathroom? And especially if you're getting up in the middle of the night and you're a little disoriented because you have to quickly get to the bathroom, does that put you at a higher fall risk? And so can we address some of that with our pelvic floor programs and then also with balance? So lots of fun things that we do in our practice. We make custom-made orthotics that sometimes can support a patient from the ground up. But the main thing is that, we want the patients to get the best complete care that they possibly can. So we're going to have 3 parts to our night tonight. It's going to go actually pretty fast. We want you to feel like you can raise your hand, let it be dynamic. If you have a question that you need to ask, go ahead and do it. And the first part tonight, Stephanie is going to go over what are some of the common causes. Dr. Burkhardt alluded to some of those, and there's even more. Some of the common causes that balance starts to decline. as we get older. What are the key systems that are required for one to have good balance? Namely, your visual system is a very important player in balance. Your vestibular system is important, and something called your somatosensory, which is basically your musculoskeletal system and proprioceptors, which Steph's going to talk about in a little bit more detail, and how important those three components are for someone to have really good balance. She is also going to take you through a modified screen of what we would do if somebody came into our practice and needed a balance assessment. So we're going to do that, and she's going to take a member from the audience, preferably not somebody that's on a crutch or a walker, just so that we can move through it, although we have those types of folks that have those balance conditions that we work with all the time. So the second piece of our presentation tonight is going to be for the younger person. And what do we do for somebody who, or somebody who's very active in their recreational sport? Maybe they're a tennis player, or maybe they're a golf player, and they need this incredible balance. So we do a little bit of a step-up type of program for advancement, and we check into the balance, and the assessment's a little bit different. So we'll show you a little bit of that. And then lastly tonight, we're going to take you through a couple exercises that we think might serve you to try to improve some of the mobility at your foot and ankle and through the hip and core. So that's what you're in for tonight, and I'm going to turn over to Steph and take it from there.
Welcome. I'd like to get a little idea of how people are feeling and what's been going on. How many people feel their balance has been declining over the last few years? Anybody admit to that? Oh, all right. How many of you had a fall in the last year? All right, well, that's a good number. How many feel a lack of balance might be affecting the sport they play? Anybody? Oh, okay, there's a few people. And then, how many of you believe that a balance-specific exercise program can actually improve your balance? Oh, there's believers. This is awesome. Now, great. But this workshop's definitely for you. I think I know a lot of patients of ours are here. But we'll make you a believer. We'll show you how we test it and show you a few exercises you can do later. We have some statistics also. You have to have the science part. Things that I have found, and I think Dr. Burkhardt mentioned this too, that about 1/3 of people over the age of 65 and almost half of people over 80 will fall at least once during the year. 75% of Americans older than 70 are diagnosed with balance problems. And they increase by almost 30% once you get to age 80. And there's a lot of reasons for these falls. This is one of the slides that I have printed out for everybody. Some of the reasons include your obvious difficulty with balance or walking. Vision problems make a big difference. Cataracts, or even wearing bifocals, or when you get those brand new progressive lenses and aren't sure where to tilt your head to see well. You have them on and maybe there's a curve coming up and you don't see that well because of those new glasses. Several medical conditions can cause trouble, such as a stroke or Parkinson's disease. They give you balance problems. Other conditions that may cause confusion, such as Alzheimer's, they may make it difficult to walk or difficult to understand varying surfaces that you're walking on. Taking more than 4 medications at a time. That's something that was kind of new to me, but there are medicines you need to take, very important things you can't stop, but maybe once in a while you check and say, hey, are all these things necessary? People often take more than 4. And you can just double check with your doctor once in a while. Are these all necessary? Because there's no specific medicine, it's just how many you take that can actually make you a fall risk. Low blood pressure is another one, that you might feel lightheaded or faint or dizzy when you stand up. Hazards around the home. It's always a good idea to keep an eye out for rugs that might slip and slide, extension cords like I have right here, a nice little fall hazard, so we'll stay away from that. And other things around the house, low lighting.
Cats.
What, pets? Guests?
Cats.
Yes. Yes,
Dogs.
I'm a little afraid of my cats on the stairs. I make sure they go down first because they love to get around your feet. Cats are nice that way. But yes, lots of things can do that. Decreased sensation in your feet. If you can't feel where your feet are as you walk, if they're numb and tingly, definitely a fall risk. Weakness in your hips or core. If you get up and your legs aren't going to hold you up well, definitely can be a fall risk. Decreased mobility in your foot and ankle. If you lose the ability to lift your foot up off the floor and start to shuffle, more likely to trip and get stuck on the carpet and fall. So these are a lot of things that physical therapy can help improve. And the more of those risk factors you have, the greater your risk of falling. Having previous falls increases your risk. We ask these questions on all of our evaluations. Having difficulty walking and talking at the same time can show an increased risk of falling. There's a test that we don't use a lot, but it's actually called the walkie-talkie test, where they have people try to carry on a conversation and continue walking in a straight line. And you might notice it when you're out in the mall somewhere and you're walking and you're running into things because your balance might not be perfect.
It's really worse.
Oh, chewing gum is way worse, definitely. Yes. Don't chew gum and walk. But I'll go over some of the ways we maintain balance. Vision is very important. You'd be surprised how many people can balance on one leg, and then you close their eyes, and it gets all wobbly. We'll probably have a demonstration later. But vision provides you with information about your surroundings and about your location in relation to the environment. Everybody would agree that's a pretty important thing. And when the vision gets a little worse, you get the corrective lenses, you get surgery if you need it. Try to help that as best you can. There's another part of the body that helps you with your balance, the somatosensory system. It includes proprioceptors in our muscles and joints that give you information about the position of your body in space and positions information about your movement in relation to other parts of your body. It can, if you don't know where your foot is when you're stepping down a curb and you can't understand, your brain's not giving you that information, big fall risk. And there are things we can improve in physical therapy in that area. There's a very special vestibular system. It's a balance mechanism in your inner ears. Most people might have heard of that. It's activated when you move your head. And it works with your vision to tell us if you are moving or if the world around you is moving. And some people with problems in this area have what's called vertigo. There's a couple different kinds, but it's often the inner ear and the crystals in the inner ear that get messed up and that you can't, you might feel the room is moving around you. And there are very specific therapy techniques that do that. We often will send people to specialists in that, maybe Bryn Mawr Rehab and probably here, but there are very specific specialists. We work on all of the other stuff. Falls, of course, cause injuries of different degrees. It could just be a bump or a bruise. If you have weak bones from osteopenia or osteoporosis, you're more likely to have a broken bone from that fall. Studies show that falling from your body height should not fracture your wrist. If it happens, that's often a first sign of osteoporosis. And maybe somebody then has their DEXA scan and finds out. But it's something that I have had a little extra training in too, is bone health and osteoporosis. And there are ways to strengthen your bones. There are specific exercises or many kinds of exercise that can help that. There are things that show, and I can tell if you have an increased risk of fracture by asking questions and doing a test or two, and give you ideas of how cautious you need to be or not, and what kind of exercises are best for you. And we've also seen, it's well known that hip fractures do cause a significant decrease in function and increased mortality. So we got to keep the bones strong, prevent falls. And once you have a fall or an injury, your mobility can further decrease, and that sets you up for maybe a downward spiral of deconditioning and weakness, maybe further falls. But there's good news. We can work on this. There's a lot of things we can do. In physical therapy, we're going to come in and you'll do an evaluation with us. We'll check you out with strength and range of motion and some very specific balance tests. A lot of these will give us information on how high your fall risk is. The Berg test is something that's about 14 tests, and it gives us a score. It'll show if it's low, moderate, or high fall risk. The TUG, the timed up and go test, also does that. If it's 13 seconds or less, it's a high risk of falling. The ABC scale is something that you would do in writing. We'd give you this form of like 15 or so possibilities, and you rate how confident you are that you will not fall when you do the following activities. One might be just walking from room to room in your house. You score it 0 to 10. 0 is, I'm not confident, I think I will fall. 10 is no problem, 100% confident, and goes all the way down to walking on icy sidewalks. Who's confident they can walk on an icy sidewalk?
Depends on the shoes I'm wearing.
Oh, do you have the little tracks that dig into the ice? Maybe. But
Depends how many seconds.
oh, what? How many seconds?
Yeah,
Oh.
I could walk about 1 second.
Oh, there you go. But it does help. It shows people how confident they are. And as you go through your therapy program, that score should increase. And you know, we're going to build your confidence up because we're going to improve your balance. We'll test sit to stand testing. How many times can you sit and stand in 30 seconds? And there's a lot of statistics on that. Oh, it's fun.
Oh, yeah.
Single leg balance. Some of the studies, there's a lot of different ones. One I tend to use is 10 seconds. Can you stand on one leg for 10 seconds without tipping over? And a lot of people can't do that. So it's an easy test to do in the office. We can demonstrate some of these tests. You know, we'll measure all the other things, the function, strength, range of motion. And if we're evaluating a balance problem, we may look hips, knees, ankle. Yes.
Volunteer.
Yes, volunteer already?
Yeah.
Come on up.
Right.
Hello.
Thank you.
I promise not to cut you in half. I will not cut you in half. All right. Sandy, come on up to the table. What's your name? Dan. Hi. All right. Let's have you have a seat. We're gonna go from the scratch. So have a seat right there. And let's see. We don't need the slides really, so I guess it won't matter if we're in the way. But part of the bird test starts with really easy tests. Can you sit in a chair for 2 minutes? We'll skip that because you've been sitting there 15 or 20 minutes. But one of them is, can you stand up from that chair without your hands? Can you do that? All right.
You kind of use them on these though.
Yeah.
Yeah.
So let me try that again.
Yeah, go ahead. Come on up.
Yeah.
All right.
I'm gonna use feel it a little bit.
All right. And then some people have to use their hands and push. So there's a 0 to 4 scale. I would still give you a 4. If you can do it, and I even said with minimal help, you pass the test.
Okay.
One of them, there's a bunch of tests. One of them is how far you can reach forward. And I'm gonna have you hold your hands out here. I'm gonna click this. Right here. And, because I'm gonna be next to you, do you have any specific balance problems?
I balance a little bit better on one leg than the other.
Okay. All right, so I'm gonna hang next to you, and we're gonna reach, what's our little tiny ruler? All right, from here, I wanna see how far you can bend forward to the end of that ruler with both hands at the same time.
Oh, right.
Yeah, all right, come back up. All right, yeah, see, not 100%. You can move away from the chair.
Yeah.
Go ahead, try it again.
No.
We'll give him a second try. Hold it straight. All right, reach forward. All right,
That's
back up.
about it.
That's really about it. So you didn't quite make it. Past 10 inches and more is 100%. So you would probably get a 3 on that scale.
Okay.
There's very specifics that I don't have all memorized. So each one, 0 to 4, we add up those numbers. Another one,
I imagine part of that is weak distribution also.
maybe a little bit, but there's, okay. So you get rid of that and you reach 10 inches. Yep, I like this story. Yeah. One of them is how easy you can pick up something from the floor. The little timer is going down
My back
there.
doesn't like that.
Oh, don't hurt your back. But that would be a 4. Easy,
Okay.
easy.
All right.
All right. Then, I set the timer. And I'm gonna see how long you can stand on one leg.
Great.
You wanna test that? Are you ready? Pick one leg up. Can you do that? Oh, nope, not like
Oh,
that. It's a
you
beautiful
got it.
tree pose. But let's see. Oh, I can't really let go too well. Is that your good leg or your bad leg? So that would,
Stop putting your hand on the back. I think
yeah.
just let me move my arms around.
No, but that
No,
doesn't
that's
count.
cheating.
Okay.
That's not part of the test. Come on back. It's not bad.
Yeah.
So unfortunately, a little wobble's okay, but not so
A
much.
few minutes or so, and I can settle down, but
Yeah,
starting out is tough.
it is.
Yeah.
It's tough, and it's under pressure right now.
But on the other
Is the
one-
other one any better?
No, not really. The other one's, it seems to be
Yeah.
a little bit worse.
Well, you wouldn't get a 0. You wouldn't get a 0. You might only get a 1 out of 4. So,
Okay.
but we'll work your way up. Whatever. Are you a competitive guy and want to get all 4s? But can you put one foot in front of the other without tipping over? And can you balance there? This is a 30-second test. And I'm being safe. That's why I'm a PT. It's my job.
Got a spot too.
He's doing good. We're at 12 seconds. We're at 20 seconds. 5 more to go.
And that airplaning of the hands is a little bit of a cheap compensation, so we'll take a
30.
deduction on that.
All right. He made it to 30 seconds.
All right.
But I was saying,
We need a bamboo pole.
Yeah, that would be.
Yeah.
the poll would help.
Okay, 3.5. All right, so we have a lot of different tests we'll do. That's part of the Berg. Another one is standing with your eyes closed, with your feet just hip width apart. Let's get you a little away from the chair. Yeah, don't let the chair cheat.
Something like that?
Yeah. 10 seconds, eyes closed. There's 5. You're doing beautifully. All right, open them back up. Easy. No, you feel any sway?
No.
It didn't look like it. It was good. All right. To stand on one leg, there's one that we put a foot on a step stool. We thought, we don't need to bring a step stool because that's a harder
We
balance
could
one.
actually do it here.
We could do that
We
one.
could actually
Let's
do
do
it
it.
here.
Let's do that one because
What is it doing?
here's the goal: is to be able to alternate your feet, right, left, 8 times. And when I say go, because I got time, yeah.
Right.
Fast but comfortable and safe. All right, are you ready?
So you're telling me how fast I can do 8 reps?
Yes.
Okay.
Just count to 8.
All right.
And go. 1, 2, 3, 4, 5, 6, 7, 8. All right. Show off. I'm just teasing you. No, but that was it. 20 seconds was the cutoff for that, and that was 6 seconds. So beautiful. Fine for that. So that's part of the Berg. It's a longer test, and it gives us all kinds of information. All the different tests on there from 0 to 4. The highest score is 56, and if you score between 41 and 56, you're low fall risk. If you scored 21 to 40, it's medium, and high would be 0 to 20. Just from those few tests, you're going to be in low to no fall risk. So those couple tests.
Except if I'm standing on one leg.
But you put them all together, and that's not so
Right,
bad,
yeah.
because that was a perfect score. Getting up from the chair, there might be others that we didn't do, but I think yours is going to be low fall risk. I can just tell from doing this for a long, long time. All right. Well, it depends how much you want to do.
Give somebody else a chance too.
Yeah. Does anybody want to do another?
Tug, I just set you up for the
Yeah,
tug.
that's
Yep.
going to be next. Anybody else want to help too? It's not that hard. It's just walking going around that cone and walking back. Oh, it looks like you're it. All right. Go ahead, have a seat. All right. And in real life, we're going to measure 10 feet. I think our stage is a little shorter.
I did measure.
Did you
mine.
measure?
I did 10 feet.
Behind my back. All right. Hang on.
I did take an inch.
Here's your job. When I say go, you're going to stand up. Don't run,
Without my hands.
but without your hands. Walk as fast as comfortable. I know you're going to be really good at this, so just walk pretty fast. Don't run. Around the cone. Come back. Have a seat in the chair, and I'll stop the timer.
Okay,
You want to try it?
sure.
All right, then go. Long legs help this test.
Oh my goodness, that's a cheat. I love
I know,
that.
it's like 3 strides, you're there. So that was 5 seconds. That test is 13 seconds for the cutoff to be high fall risk. And we don't want people to walk fast. That's not the goal. But if you walk really slow and have trouble, that tells us something about your fall risk. So our goal is not to make you speed walkers, but it is a way to see improvement. Someone might have a hard time getting up from the chair, take 2 or 3 tries, takes them a long time, and turning around that cone is often hard. That makes a difference. So
If you caught me in the morning, I'd be walking a lot slower.
yeah, so you're warmed up
My-
now?
My feet, my feet give me a lot of trouble.
Yeah, so that makes a
That's-
difference.
That's part of why I can't stand on one leg too
Mhm.
easily
Because of your feet.
either. Yeah.
Yeah. So I see that a lot. A lot of balance patients come in and don't realize what their feet are doing. They might have tingling and numbness, or just tight or pain, and they can't move their ankles. Makes a big difference. Almost everybody that I see for a balance problem is working on their ankles. Probably a few people I know in here are probably working on that. So that's some of the tests we will do in physical therapy. Thank you for volunteering.
Okay.
That was a good job.
Thanks for the assessment.
We'll test you for real someday. And there are a lot of other tests we do on younger patients. So I'm going to turn it over to Chris to do some information and give you some ideas on that.
Yes, and I may have you come back up. I may want to get you back up there for our younger person. Yeah, so, someone, I forget your first name.
Dan.
Dan. Someone like Dan, you know, he's showing up pretty good in some of that testing, you know. Somebody else, you know, may really struggle with that. Dan, do you feel comfortable for me to go through and take you through a little bit more advanced, or I can do it on Steph? She already failed some of them earlier today, so I don't want to make her feel bad. All right, and then Steph, you can be a spotter for me. Okay, so Dan, come on up.
Sure.
Great. Just have a seat here for a minute.
I think my wife should come
Okay. Oh. So have a seat.
on. Okay.
So, yeah, so as I had mentioned before, when we do higher level testing, we sort of start with that functional movement assessment, but then we get down to the nitty gritty, which is standing on that single leg and going into squatting. If somebody fails that position,
When you say squat, you're talking about like a deep knee bend or
yeah,
what?
deep squat, and that's another piece, but we're gonna just
My
say,
knees aren't gonna tolerate.
no, we're not gonna do
Yeah,
that,
okay.
we're not gonna do that, yeah. But what I am gonna say is, we saw that you had some wobble here with your eyes open, right?
Mhm.
We're gonna repeat that, I'm gonna repeat that again,
With
Steph
my
would
eyes
be my,
closed?
well, yes, you're on to me now. So, and in a higher level assessment, we actually might wanna hope to see if we can hold that for 20 seconds. But we saw that that was a struggle for you, but I'm gonna take you through a little bit, and so let's get you back up on your feet. So the first piece of this testing, and Steph's just gonna spot, just in case. So the first part of this testing again is, which leg did you say you thought was your stronger leg?
I think I can balance better on my left leg.
All right, well, let's start with the left. Okay.
Okay.
So, and any of this airplaning, you know,
Not
it
left.
catches my eye and it's no good, all right? So I want you to stand on your left leg and see if you can actually bring this leg up to 90 degrees. Good, and Dan, right there, see if you can hold that, arms down at your side, breathing, nice easy breath in, breath out. Not bad, not bad, okay, so close to 10 seconds. Why is the breathing important? People hold their breath, they rigidify their system, right? And with athletes, we have to be able to move with ease and be able to breathe through motion as well. What did you say?
If I don't breathe, I pass out.
Right, I want you to breathe too, that's important.
Yeah.
Right, okay, now let's compare that again on the right leg. And so he didn't make it quite to the 20 seconds, and that's okay, all right? Now comparing to the right leg, get that knee up, put those arms down, Dan. All right, okay. All right, so let's sit for a minute, Dan. So now we say, okay, listen, Dan's got a problem. It's very obvious that there's an asymmetry. His right side is much worse than his left side. We're not gonna close your eyes because we already saw this problem, but if you did really well and you were able to hold that 20 seconds with eyes open, really, really great, no problem, then we would do an eyes closed test for somebody younger.
Well, I should probably tell you I have plantar fasciitis in both feet. So-
Okay,
And it's worse in the right foot.
Gotcha.
I
So
think
that
that's
could-
a lot of it right there.
absolutely that can be in play. Because as Steph said, you know, we're looking at different systems. We're looking at the visual system, that's why we do it with eyes open and eyes closed, because if we take the visual system out, it makes it all the harder. The vestibular system, do you ever get vertigo, dizziness?
Not from inner ear. I got it once, long time ago on a flying lesson with flicker vertigo. The sunlight strobing through the prop.
Okay.
So it lasted a couple seconds. I looked away and it immediately went away. But that's
Were you
that's
flying,
not a balance.
were you flying the plane?
I was, yeah.
Oh, boy.
Yeah, it was one of my early solo flights.
Oh, boy. All right,
Yeah,
I'm not
but I-
flying with you. I do like to fly, but I'm not flying with you, just in case.
No, in 1,400 hours of flying, this is the only time it happened.
That's all right, Dan. I'm not gonna test my odds with you.
Yeah.
All right, so vestibular. So now I am gonna test your vestibular system. So we'll test it, we'll see where you do today. But the other part is the somatosensory. We talked about what's the effect of the musculoskeletal system and what's the effect of injuries, right? So when we talk about musculoskeletal system, in your muscles and in your joints, you have these little proprioceptors. They're also called mechanoreceptors.
Just
And
like a position sensor, right?
they're position
Yeah.
sensor, right, and they respond to pressure and loading through those sensors to give us sort of where we should be, you know, in a balanced situation. When you lose range of motion in your calf, your plantar fascia, all that valuable information is not then being traveled up through your musculoskeletal system, through those receptors, through your peripheral nervous system, up to your brain. And then the brain helps to create that, I see a change in the environment here, and we have to balance Dan out. We gotta turn on certain muscles to make that happen. So if you're super tight and you're not really moving well, then that alone can shut down that input, which is so valuable. Maybe you're getting 25% of those valuable train of input that's getting up to your central nervous system and your brain for responsiveness. So of course, that would make you more unsteady. So again, like I said, we see this in orthopedics all the time. So now we have to say to ourselves, okay, Dan has a problem in uni-stance. Let's rule out and see, what are the 3 different buckets, that could be problematic for Dan. A is his vestibular system, so that's what we're going to test next. And if he passes that with flying colors, then we're like, okay, maybe it's not that. Is it down at his foot and ankle, which we'll also test, or is it his hip and his core stability? So we want to tease that out just a little bit. We're not just going to assume that it's this problem down here. We're going to work a little bit harder to find that out. Okay. So now I'm going to have we're going to do the vestibular system. So don't be scared here, Dan. And Steph's going to spot.
Can't find the button.
She's going to spot the work.
I'm
Oh, thank you.
I'm not scared.
All right, good. All right, and we're not going to have you near the edge of the stage. Okay.
Okay.
So let me show you first what I want you to do.
Okay.
All right. I'm going to spot you, but the very first thing is we're doing a clinical test, which is really the gold standard for vestibular problems. So Dan is going to be standing on 2 Airex pads, which are soft, and they give you that sense as if you're squishy and as you're moving. So the very first thing that Dan's going to do in a static environment is he's just going to hold that posture, and we're going to see if he can hold it for 20 seconds. Okay? If he passes that, if he fails that, we don't go further. But if he passes that, then we'll do it with eyes closed. So carefully, Dan, step aboard there. And then just get in that position, and I'm just going to be in front of Dan just to spot him. And eyes stay open.
What are you looking at my feet for?
All right, so that's a pass on that, right?
Okay.
So now we'll go further. So now we're going to have you close your eyes, and again, we're going to hold that balance, and I got you, buddy.
A little bit more wobbly.
Really awesome. Open your eyes. Step off there for a second, Dan. So Dan passed the static test, right? And actually, Dan, you can have up to 50% more sway when you close the eyes. And you did really well. But no, you were not like that bad.
Yeah.
That was really good. All right, so the next piece, and I'm going to demonstrate this, and then we'll have you do it. So we're going to get back in this position. Eyes are going to be open. And what you're going to do, Dan, is we're going to now test the inner ear. And there's 3 different canals. So we have to, and it's based, like Steph said, on motions of the head and neck. I don't want you to hurt your neck, okay, if you have any range of motion issues. But what I want you to do is the very first thing we're going to do in this position, eyes open, is right, left, right, left, right, left, center. And we're going to see how you do, okay?
Okay.
Then I'm going to say up, down, center.
That was down and up.
Okay, and then side is always a clown, center. Okay? And we'll see how we do it. And then you pass that, you know it's coming. Eyes closed. So come on and step back up on there. Good position first, so you really feel confident there. And it's got to be that quick. So we're going to do side, center. Up, down, center. Wait for me now. You're too fast.
Sorry.
Ear to shoulder, side bend, and center. Pretty impressive, Dan. So Dan gets another good check for the dynamic piece. Yeah. Now listen, when you do this eyes closed, when we go turn, sides, rotation, when I say center, you don't get to open the eyes, you have to keep them closed.
Yeah, okay.
Okay? So, ready? Okay, go. Turn, center. Up, down, center. He's quick on me. Wait, side to side. All right. Awesome. And center.
Whoa.
Is he better than I was?
Yeah, I think he could be. Last one. Stay on again. Well, that last one of the side to side. Okay, let's
This
close
one?
the eyes again.
Yeah.
One more time. Go. Side, center. Okay. All right. Then let's have you step off and then have a seat.
Good.
Okay, so Dan, have a seat. did that make you feel, aside from your balance being a little bit off, and I probably would give you a little check mark on that one, that would be something that would need to be potentially addressed from a vestibular standpoint, but that was really darn good, really good.
Okay.
But did you feel any nauseousness,
No,
dizziness,
not
or anything like that? But that is different, your
I'm
canal.
fine, I don't get air.
Yeah, okay, good. All right, so, but all in all, I thought Dan did a really nice job with the vestibular system, okay? So now we're gonna say, all right, Dan, let's go ahead. Very good. So now we're gonna see if we can break him. We wanna see if we can break this guy down, because he's way too good here.
Now,
So-
now keep in mind, I'm not a pilot for a living.
Okay.
Okay.
All right, so Dan, here's the next piece. Let's see if this is sturdy. Okay, let's get you back up on your feet. I'm gonna use, instead of the screen, we'll use this guy over here. So I want to check your ankle mobility, because that's the next bucket, right? That's one of the three buckets. So I'll demonstrate first. So Dan, what you're gonna do is you're gonna lean up against this wall, and you're just gonna put one foot in tandem behind the other, and the foot that's behind the other, the knee has to stay straight, okay? Then what I'm gonna ask you to do is lift up your toes and side to side with your foot back and forth like this. And I wanna just see, A, can you do it? So let's get you in that position. Yeah, arms up there, and then put that one foot in tandem behind the other. Dan he's the man there. Okay, got it, Dan. So he's, so the left one can have a little bend to it. This one, but I keep that one straight. So the test is, can he actually clear that motion, and he's doing it well. Switch it up for me, Dan. Good, tandem first. Don't go yet, Dan. He's too quick. Now, this knee straight, lift up the back leg, your toes up, and then switch that foot side to side. Not so much from the hip,
I
Dan.
have a lot of friction on my heel
Yeah,
here.
okay, and then relax. But the fact that he can clear the toes and do that, that's actually pretty good. So let's look at another piece. In this same position, Dan, and this, can you take your shoe off real fast
Sure.
for me? So this next one I'm gonna demonstrate is, I wanna see how high, both of them,
Okay.
how high Dan can get his heel off the ground, and the shoe always throws me off, so I like to look at it visually. But Dan, what you're gonna do is same position on the wall, you're just gonna get one leg off the ground, and you're gonna raise up real tall, and I wanna see how high that heel's kicking up, and then we're gonna compare it right to left. So, yeah, so, as you're here, Dan, as high as you can go, so bring it on down. So that's a problem right there, Dan, you're not going very far on that, you're going about half the distance in plantar flexion. How about switching legs for me? And if that
I may
hurts,
have misunderstood what it is you want me to do.
okay, so stand on the left leg and then bend this one, and then I want you to raise up on your toes as high as you can on that left foot. That's still a little tight, Dan, and bring it down. Okay, let's switch feet. If this hurts with your plantar fascia, Dan, I want you to just stop, okay?
Okay.
Go ahead. Yeah, and definitely different in the
That's about it.
limitation. Yes, okay, so stop on there. Let's keep your shoes off for a moment.
Okay.
So we know that if we were going to be addressing Dan in physical therapy, we have to clean up those pieces of his plantar flexion, okay? Because that's going to affect his overall, information that's getting up to the brain, like you said from that particular. And the plantar fascia, the plantar fasciitis is connected to the calf, so that makes sense. So have a seat here for me. I'm going to do one more little test here, and this is going to be get your heels underneath your knees. Your feet are going to be sort of shoulders width apart. I do not want to see you moving your knees in and out, so we're going to stay quiet from the knees to the hips now. And what I'm looking for, roll up your pant legs just a little bit for me, Dan, so I can see.
You
Get a
see
good,
what I'm doing.
yeah.
Right.
Because then we're going to look at inversion, eversion, and we're just going to take a quick peek at that. So, and by the way, do you wear orthotics?
Only what's in the shoes.
Okay, I got you. All right, because you're pretty flat-footed. So anyway, so let's be in this position. Now, Dan, roll up the arches like this, and then roll them down and in. Yeah.
Without moving my knees.
Without moving the knees, yeah. And real limitations in movement here, yes. And pull up, yeah. Roll up the arches and down. So
I do it without moving my knees.
let's
yeah.
show the audience. Let's turn this way, and you'll see side by side. And maybe you'll see a difference with me, even though I also have a little bit of a limitation. So we're not allowed to move those legs, but the first thing is roll the feet so to recreate the arch, okay? And then roll the feet so that you collapse the arch. and we're rolling up.
They're not rolling in with it.
Yeah, we're rolling up. So there's other pieces that we would definitely address from your ankle mobility standpoint, okay? So now we say, well, what about his hip and his core? Are they also part of this problem that he can't balance on this leg? We found other areas here that we need to clean up. Maybe a little vestibular piece, but that's a high-level vestibular piece, so I'm not as concerned. This I would be more concerned about addressing. So now we're going to say, let's go to the last bucket, which is the hip and the core. So here's what I'm going to show you first, Dan, and then I'll take you through. So now everybody wants to blame the ankle, right? Everybody wants to blame the foot and the ankle.
That's where I feel it.
How about if we take that foot and ankle out of the equation? Then we're going to see what's left in the hip and the spine. Okay? You're with me. I can see it. All right. So we're gonna get back on this leg. We're gonna do your easier leg that was to balance, which was your left leg. So essentially, when I am kneeling on this, I've kind of like amputated that rest of that leg. It's gone, right? So we're not going to be using your foot and ankle to help us here in any way, shape, or form. Okay? So what we're going to do now, and I'm going to let my foot be soft here in the back, is you're going to start down here, Dan, like a runner, and you're going to edge this other foot right in line with this thigh. And then when you're able, if you're able, and Steph and I are going to spot you, you're going to come up, and you're going to probably feel like you're wobbly, and then we're going to see, can you settle, and can you hold that balance without the foot and ankle? Now we're talking about the hip and the spine.
Without the help from the other one.
That's right,
Yeah.
right. And we're going to see, then we'll compare it to the other side. Okay, that's a fancy test. All right, let's do it. So Dan's going to put his left leg down. This one's out, goes forward. And one of the catch-all, Dan, is you can't use your toes back here, and you can't kick this leg out to the side. So we're going to keep, Steph's going to keep an eye on you here. And actually, Dan,
Already not balancing.
yeah. So let's actually just take it from this standpoint. I won't even have you take it from the ground up, and I want to see if you can hold that position. All right, I'm pretty good from that. So I'm going to say yes on the left side. Let's switch it up and let's take a look at the right. So we already know Dan's got some problems with the feet, but now we want to see, does that problem also run all the way up to his hip and to his spine? And is he looking good there in the back?
Trying to get
Don't
my,
use that toe.
trying to get my toes situated there.
Okay.
Yeah, he's fixing it.
Okay, and then relax your arms. Dan looks actually a little bit better than me.
I feel like I'm doing a lot with my thigh on this
Yeah,
side.
that's okay.
Do it.
Yeah.
And then let's have you come off out of that. So that is excellent work there. And so, Dan, I'm going to say that you're, from that standpoint, from your hip up to your spine is actually, pretty stable. So this problem is coming from down here in multiple planes of motion, the side to side, which is the inversion and the eversion, and the plantar flexion. There's one more. Do you have super bad knees?
Define super bad.
Would it hurt for you to kneel on this pad, this cushy pad?
It didn't when I just
Okay,
did it.
good, because I'm going to give you one more. So the fact that Dan did well with that last one, I don't necessarily have to do this piece, but let's say that Dan was kind of all over the board again. And then we want to, this is what we do as PTs, we want to say, well, is that coming from his hip or his spine, or can we tease it out even more? So if we do one more test, we can tease it out even further. So I'll demonstrate it first. So this next test, we'll have your knees on here, Dan, and you're going to be in quadruped, all fours. And what I'm going to say to you is we're going to start with you keeping your left leg down. So we're going to start with the right leg in the air and the left arm. And you're going to just see what you can do as far as holding steady balance, right? But again, I'm balancing on my left leg, and then we'll switch it up. So I want to come on all fours first. I'll walk you through it.
Take it, most people don't want to do this one.
This is fine. This is, for the younger population, a little bit more active. We don't do this with everybody. We do mostly what Steph does, but we also want to know that it's there. So Dan, you're going to extend out your right leg for me and your left arm. Left arm up in front, and you're going to hold that.
That's not so bad. That's good. That's really good.
Nicely done, Dan. Switch it up. But I already knew he was going to be good because he passed that other test.
Yeah.
But this was in case just to define it all the further. So Dan, good job there. So come on back up carefully to standing. So your balance problems, in my assessment, with a higher level person, I would say we got some issues down here at the foot and ankle that should be worked, in inversion and eversion, as well as the plantar, flexion. And working through that in physical therapy was something that, should be done. Doing stuff on your own for home exercises. The hip and the core in this moment are pretty good, so that's where we clean this up and do better.
Okay.
Thank you, Dan. Yeah, well, and that's why we want to do that, that extra bit of testing, because it really hones it in for us.
Is that it?
That's it.
Okay.
I want to share with you guys something else that's really, really exciting, and Steph's going to pop this up on a slide. So, I came across this product that I thought was like going to be for the birds, right? And a friend of mine from California, she said, Chris, you got to try this product. It's called Vox Socks and Insoles. And she said, the socks only cost $30 and the insoles are like $45. And I'm like, yeah, Nance, what's it going to do? Like, what? Tell me a little bit more. She said, it's amazing. She said, it's helping people with their balance and so on and so forth. So before I decided that I would try it, of course, I had to go do my research online, and I was watching different videos, and I'll give you a little background on it, and then I want to show you an amazing video that'll knock your socks off. So I go on the website and I check this out, and there's this man that designed this particular product that's a patented product, and this guy was from Canada. And so this product is more in Canada than it is in the United States right now. And he developed it because his mom had MS, and he wanted to be able to help her with her balance and her stability. And there was like 45 years of research that he was combing through, trying to get to, how can I affect the brain stem and possibly affect, patterns of movement in a non-invasive way, in a non-chemical way, and not without using electricity, because, with a lot of patients that have severe problems, be it MS, ALS, Parkinson's, even, after a stroke, they're really struggling, with their balance. And the brain stem is, the one area in your body that you really, like the one area in your brain, I should say, that you can't live without. Everything passes through the brain stem. The ease in which you're breathing that you're not even consciously aware of passes through your brain stem. Your thermal regulation, when you're hot and cold, passes through the brain stem. All of your motor function, all of your balance receptors, and all of that whole system passes through the brain stem, including your digestion, so on and so forth. You can live without other areas of your brain, maybe not well, but you certainly can't live without your brain stem. So anyway, I get this product, and this is a really big insult, but you can see that there is this little area on the sole of the foot that matches out from a, reflexology and from a neuropoint stimulation that actually matches out, looks like a fingerprint, and it actually maps out to your brain stem. And so we were talking about, how do we, affect the way the nervous system communicates with the peripheral nervous system, communicates with the central nervous system and your brain stem, so that movement patterns might become easier. So this guy did this research. After 6 years, they came out with this particular product, and I was totally not about it. I was like, I don't believe this for a second. This is kind of crazy. So I'm going to show you a video. So I tried it on myself first. I was like, I always try something on myself first. But I'm thinking, what is there to lose, right? It's not like, certainly ways in which you affect the nervous system would be chemically, so chemicals, for Parkinson's and other types of conditions is one way to contact the nervous system and affect the transmission. Second way is, especially for people in chronic pain, they use spinal cord stimulators, that's electricity. Okay, this is a sensory neurotransmission. So anyway, So I want to introduce my friend Sean, who gave me total permission via HIPAA that I could share this video. And I tried this product on myself, and the worse you are, the more this product seems to be pretty impressive with your balance. And after you see this video, you'll understand why I now have them in my facility, and we test patients out on them all the time and say, hey, does this work for you? And you know, so here's the story of Sean. It's just a quick video, and this is phase 1 when I went to her house. Hopefully you'll be able to hear it. So Sean, she also has pretty severe gait disturbances.
There will be no sound.
Okay, so right now, we're not gonna get the sound here, which actually is probably good because my voice is annoying when I hear it back. But so Sean right now is not wearing any product. She's not wearing the socks or the insoles, and she's doing just 4 exercises that I found challenging for her. And so a finger to nose is just a basic coordination test. When she did it on the right, it was a little choppy, which we call cogwheeling. Okay, and then she got super good on that on the left side. I told her to knock it off, she was too good. The next one is, you know, to get her shoes on, there's a slide up the leg. Now you can see how much Sean is struggling with that. You know, her whole nervous system from her head and even into her left arm is struggling severely for her to get that up the leg. She's even cheating using her hand to do so, okay? This is what she goes through every day, right, to get her shoes on. Not anymore with this Vox product. I'm just giving you a spoiler alert. And it's easier on the left side for her. And then I said, all right, let's try going from sit to stand. You know, and this is a task that she struggles tremendously with, can't do it cleanly, very shaky. We do it a couple tries, and mind you, I'm over at her house videoing her, thinking that this is not going to work, thinking like this is going to be, you know, underwhelming. So now I just said, Sean, let's take a stroll. And can you guys see that, or is it too? Is it too hard to see? And you can see there's a staggering gait. There's a lot of arm motion. It takes her several turns to feel safe to be able to turn back. And you know, her ankles are turned in. They're like cement. You know, they're just not helping her in any way, shape, or form. Very, very unsafe. Most times she has to use a cane. So that's phase 1. Okay. So now we're going to go to phase 2. So phase 2, I had to switch the shoes because I couldn't pull her insoles out. But I thought, you know what, I'm only here for a short period of time. I'm going to have her put the socks on, and we're going to put the insoles. We're going to go full gusto because she's pretty severe. I won't waste her time or anything like that. So we put them in her regular sneakers. She had a pair of these on and a pair of socks, and I said, all right, let's repeat those tests. So she's got the product on. We're going to go back to the finger to nose. And it's way smoother, but the other stuff is even more impressive.
This was all during the same visit to her
Yes,
house?
it was within minutes of me putting these on, taking them off, and then I took them off and we repeated it. So that was easy for her there. So she was. But now we're going to go back to sliding the leg up the shin. Much cleaner. You guys see how much cleaner that is? She's not pulling the whole head in and into the flexor synergy. You imagine how much energy she spends, you know, on a regular basis, which has changed a lot since she started using the Vox socks and insoles. And I have no vested interest in this, but this was an interesting piece that I was like, oh, holy mackerel, how many patients can we affect with this? Or at least try it. The dog's rolling over in the background. The dog wants the socks. Now look at her sit to stand.
Wow.
Honest to God, like that sit to stand, clean as could be, right? Before she struggled. And you'll see when we do the last phase, we take them back out. So she's a scientist. She used to work for one of the drug companies, and she was like, yeah, I think it's a little better. We're like, Sean, it's a lot better. And I said, let's try to have you not push off and see whether you can get up, and she couldn't, but she couldn't do that before. So now we're going to see her stroll. Much more narrow base of support, less movement of the arms and trunk. Actually, you can see some foot clearance and dorsiflexion. Smooth turn. I started to be like, oh my goodness, you know. So she says here, you know, maybe I'm just warmed up. And I said, well, maybe you are. She goes, oh, maybe it's the box socks. So I said, well, maybe you are. And if you're warmed up when we take them out in the third little segment, you're going to be just as warmed up. You'll be even better. So you should look just as good. I said, who knows? I don't know the outcome here. We'll play. So now we're going to show you phase 3. We took all the products back out. She's back to her normal self. I said, go for it. You're warmed up. Let's see how good you are. That's about the same. That wasn't super, super challenging, but it's still, so then maybe she is warmed up on that. And we're going to go back to the sliding up of the, and we're back into that awful, awful pattern. Is that like crazy? Like it's, you guys are not as wild as I was. This is like so amazing to me.
Did you let her keep them?
Oh, sure.
Okay.
She actually has a couple pair now, and she has socks for every day of the week.
Oh my gosh.
I mean, it's that impressive, right? And then we'll see, all right, let's see about her sit to stand, see how that is. Is that, who thinks that's amazing? Raise your hand.
Yeah, well,
Okay, because you're not oohing and ahhing, so I just
but
wanted to understand.
we're
internalizing
stand up
it.
like that don't have MS.
I know, but look at that, right? How much of a struggle. And then we're gonna look at her gait again.
Huge difference.
I'm not saying this helps everybody, but what we're doing in our practice, and you'll see her walk, is, you know, if somebody's got a balanced disturbance, why not test them on it and see whether it's actually a little bit better? You know, if we use that product. And, you know, there she is unstable again, almost painfully so.
And there's
And-
socks with this also?
Yeah, there's socks, or you don't have to wear both the socks or the insoles, but, so anyway, Sean used to be a singer-songwriter in Austin, Texas. She's got this beautiful piano, baby grand piano in her home that I said, Sean, you got the socks on, let's go downstairs. I want to hear you play. I haven't heard her play in years. And she normally could play the piano, but she was very contorted because it was very uncomfortable. And, you know, she said to me, and I said, what about those 4 guitars? She goes, I can't play them because my index finger doesn't work. I can't use my index finger. I said, well, let's just test this out. You got your socks and shoes on. You got the box product in. Let's see. She got down that piano, sat beautifully. I was like, oh my goodness. I said, let's get the guitar down. Got the guitar down. You could use the index finger. Now fatigued because she hasn't been using that. Just like when she goes from sit to stand, she hasn't used those glute muscles like that in so many years. But now with that product, she can start to actually, hopefully, strengthen them a little bit. And she said, Chris, remember how I can hardly get my hair to put the ponytail in? I'm like, yeah. She goes, look at this. So anyway, I just thought it was really like, it blew me away. So, you know, when we have patients, and we've had, you know, Sean, the worse you are, the bigger, you know, it seems to show. But at the same token, I have patients that have nerve damage from, you know, their back injury, that, you know, just can't stand, you know, safely on that one leg, and they're wearing the socks and they love them. We have some patients that we've tested with Parkinson's. I have an ALS patient. I can't wait for her to come in just to see if it can help her with her swallowing and her breathing and her respirations. So it's pretty exciting. And the good thing about it is, if they don't work, they don't work. You know, no harm, no foul. And they're, you know, they have a money-back guarantee, this company, which is pretty impressive.
Is this the brain stem that you're talking about, that this is affecting?
Yes. They don't even know exactly how it's affecting the, but they're saying it's kind of like rebooting your computer, you know, or it's creating a homeostasis or a sense of balance in the system, because there's, you know, and so it's really impressive. So that, you know, if I just thought I wanted to share that with you guys.
So have they done enough research on it to know if it slows the progression of the disease processes?
No, they haven't said that, Jackie. They haven't said that. And, you know, I'm playing with it a little bit because, you know, of course, when I had Sean wear them, she was so excited because she could do so much more with less effort. And so I had to titrate her back and say, don't do too much more because I didn't want her to fatigue herself because she was so excited about this new piece. But the research is kind of ongoing. This guy started this out for his mom with MS, but they've also tested it, and I think Steph's got some of the research. Is there another slide on some of the research? They've even tested it in the California Performance Institute for high-level athletes, and they're finding that there's an increase, you know, certainly an increase in balance, increase in performance from a velocity of their strength components, better range of motion, I think 15% more range of motion. So they're testing it outside of, you know, people that also need it for balance. They're testing it in healthy hockey players. There was a labor union that they tested it, you know, to help to create stability. So it's pretty impressive.
How do we know there's not some placebo effect going on there?
Well, you know, from a placebo effect, you know, Sean couldn't do that motion when I first had her, you know, go through that plane of motion. I don't think that Sean could do that motion. I've worked with Sean for a couple years now. I've never seen Sean be able to do those motions in all the time. So for her to instantly be able to do that type of thing and feel it with ease in her body, I don't think it was one of those things where, oh, I have that. I mean, somebody else might be able to be like, you know, but this is somebody who has pretty heavy duty motor control issues from a central nervous system problem. It's not like you or I, if I wanted to, you know, fake it and I'd say, oh yeah, I can't do it now. And, oh boy, I can do it now. It's like one of those things that it's, you know, it's hard to sort of have a placebo effect. But, you know, and again, it's one of those things that, you know, if it's something that's of interest, it's there. It's something that's not of interest, you know, and each individual kind of makes their own decisions on it. But there's more information on the website, on the Vox website.
What do the orthopedic guys think of this?
I don't know. I haven't talked to any of them about it. I just discovered this 6 months ago, and I was like, holy mackerel. I'm sure they probably don't know about it. Barry, did you know anything about this product from a family medicine standpoint?
I was gonna say, how long has it been available for us?
It was available last year.
So, you know,
In
that
Canada,
was
in Canada.
That was obviously impressive. I mean, so, you know, if it's out of Canada, like the bigger institutes up there, like McGill, things like that, would have to get a hold of this or whatever. Because it's almost like when we do drug studies, we do studies, if one product is so outstanding as opposed to the other one, we almost have to stop the study and introduce the product to the patient. So if this is like, you know, we worked very well on her, obviously, but if it's that good, it has to be like, you know, the centers, like the Penns of the world, the Stanfords of the world, the Hopkins of the world, would have to pick up on it.
Yeah.
And when I say that, it's not going to correct the disease state. I think
No,
someone asked
absolutely
that,
not.
Okay, so I can't see it correcting the disease state, but if it
No.
helps quality of life and helps things like that, it's obviously very valuable.
Yeah.
But, I mean, it has to be like, you know, obviously done in double-blind studies, he said.
Yeah.
And dumb studies where doctor and patient don't know what's going on. But, you know, no matter what it would help, like that was dramatic, obviously.
I say.
And
I know.
What's more dramatic is how quickly it worked, which
Yeah.
I couldn't explain. But
No.
anyway, I mean,
Yeah.
I can see it improving quality over a period of time maybe, but as quickly as that occurred, it was unbelievable.
Yeah.
And, but you know, it sounds great, and like I said, if it's gonna be that good, I mean, the institutes have to pick up on it.
I would hope so. Yeah. You're back there in the corner first.
Is this the same company as Vox Life?
Yes, it is through Vox Life.
Okay, one of my dear friends just took a vice president's role. She lives in Washington, but will travel back and forth to Canada. And I was reading just a little bit about it and was intrigued, but you know, your explanation is so much better than what I found on the website. But is my understanding correct that it's a direct marketing company? I mean, this isn't sold in a retail setting. It's
No, it is. Yes, it is. Well, actually, anyone can order themselves. So there is two branches of that, right? So you as a consumer could say, I want to order these through Stephanie, for example, because I know she stocks them. Or you, as a consumer, can say, I want to order them directly myself from the website, and you can. You don't have to become, a distributor for it at all.
That was my miss.
Yeah, you do. You do not. Yeah, you do not. Yeah.
What's been your experience with Parkinson's patients?
I've only tried it with a couple Parkinson's patients, and again, what I do very individually is I find 4 different tests that an individual with Parkinson's might struggle with, that particular person, which could be different than this person over here with Parkinson's. And the gentleman that I tested it and the lady that I tested it on, they actually felt much more stability when I challenged them. And I challenged them actually on the phone with their eyes open and just kind of pushed them around a little bit, and it was like significant. So it's one of those things, if it works, it works. If it doesn't, no harm in trying, as far as I see. Yes?
What about stroke victims? Have you worked with any patients that have stroke? Can it be used for stroke?
I would imagine that it could. I haven't done that yet because we don't see that many neuro patients in our practice. We happen to catch them in for something else, like a balance problem or an orthopedic problem. So I don't know, but I'm sure that they're probably using it for that because I can't imagine why not. Because that same synergistic motion that Sean has with MS is often the primitive patterns that a stroke patient will pull into when they're struggling with a certain task. And if that pattern can be broken with ease with certain movements, I would say it would be something worthwhile trying for sure. Anybody else on a question? And then we're going to do one other quick little piece because I know you guys are probably getting ready to fly. Okay, so you guys, are you interested? Let me put this out to the group. Are you guys interested in the last little segment that Steph and I was going to do with you guys? It was going to be a couple exercises. If you're interested in staying for those, let's do them, and we'll just do 5-10 minutes worth of exercise. They're also in your packets. And if anybody did not get a packet, see Joyce back there because we have some exercise. So if you guys are interested, we're going to go forward and we're going to talk about. General consensus is a couple more minutes. Okay. All right. Good. Okay, now I'm getting hot. I was actually hot before. Take off on there. Okay. So Steph's going to go around the room now. If anybody has an ankle brace on their foot, I don't want you to take all that off. Okay. But we're just going to start with just some ankle mobility. So uncross your legs, push your chairs back just a little bit, and we're just going to start with ankle dorsiflexion and plantar flexion, which is in the chair, lifting the toes up, and then toes down and lifting the heels up. So just simply little rocking of the feet up and down in the chairs, okay, just to get some of that ankle motion back and forth. So that's an easy thing to do anywhere, anytime, okay? The one that's a little bit trickier is the one that I did with Dan there. And so come back and let your feet be still here. And while you're in the chair, see if you can gently roll your feet to the outside so you create a dome, you create your arch if you're able to. And then pause and then roll your feet a little bit to the inside, like you have real flat feet. So just a little bit of rolling to the outside. Now when you do that rolling, you don't want your hips and your knees to be doing the motion. You want to stabilize from there. You just want to roll your legs, your ankles in and roll them out. So just kind of a back and forth also helps to kind of open up the pathways a little bit. Okay? So good. How's everybody feeling with that? Everybody okay with that? Just simple and easy to do?
I can't do that any better.
I know, I'm sure you can.
I'm not doing it very well.
Okay, all right. So there we go. So there's some actual pictures of the up and the down motion. Do we have side to side too, Steph? Side to side. That's Michelle doing that side to side, and that's Michelle also doing a calf stretch. But before we go into the calf stretch, if you guys push your chairs back a little bit, I want to show you how to do a correct sit to stand. And you can hold on if you need to for balance, but a correct way in which we go from sit to stand, where we activate our core, we hold our core muscles in nice and tight, is we actually lean forward, okay? Leaning forward is what we call a hip hinge. Now, you say, well, that doesn't feel like it's the hip, it feels like it's the torso, right? And it is. So when we lean forward, the torso comes down, the hips are behind us, And what we do is we squeeze our backside and we come up to stand. So give yourself enough room to do that. And you'll notice, excellent. And then you'll notice if your knees kind of kiss in and smack when they go up and down, then that's work that we need to do to get your hips a little bit stronger. And then sitting on back down, you can reach for your chair so you know where it is, but you're trying not to use the arms of the legs. Lean forward again, tighten up your core, and squeeze and come on up. Good, and then send your hips back to that chair, back, 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 back. Everybody's looking pretty good.
Well, it's all about getting your center of gravity over top of your feet, right?
That's right.
Yeah.
You would never want to get up from a chair, you know, sitting at 90 degrees and try to get up like a little piece of toast popping up. You always have to lean forward and then squeeze and come up, and then come on back down. So that's an exercise that if you did, and it, you know, if it felt okay for you to do, you know, 5 to 10 of those, that's perfect. We get some patients that can't do that, and we have to put one of those pillows on the chair so it gives them a little bumper that they can achieve that, and then we take that pillow away as they get stronger. Okay? So that's
I
one.
find when I try that, I tend to push the chair backwards.
So I would put that against something that's not going to move. Okay? We don't want you to be in a heat. Okay. So now everybody gets standing, and just use the back of your chair or your table for support. And we're going to put your feet shoulders width apart. You're going to squeeze your backside muscles tight, hug in your belly muscles. You're going to raise up on your tippy toes, and then bring it on down. Like this. That would be hurtful to your spine. You want to keep it level, and we go out, and we go in, and we go out, and we go in. And you can try 5 to 10 of those on each side. Again, that starts to help to build the hip and the core stability, because that may be one of those buckets that you guys are having problems in, okay? And then the other piece is to start to practice standing on that one leg, but you may need the support of 2 chairs, but just see if you can hold on to a table and just start to get pressure down through those legs, right? And hold on for support so you don't feel unsafe unless you feel like one hand is good. And you just try to start to practice holding for 10 seconds. You're giving all that great input to the proprioceptors in your feet that gets that message up to the brain that helps to work on reactivity. Okay?
I don't even need to hold the chair much. All I need to do is use it for location.
That's right, and that may be great for you, but someone else might need to do a little bit more. Okay? Great. Excellent. So they are just a simple little baseline of exercises. And I will also say that we always offer complimentary screens in our practice for any type of thing. You guys can use that for a complimentary balance screen. They're only 20 minutes, okay? They're great for any particular part of the body. If you guys are interested in any complimentary screens, you're going to see Michelle and Joyce in the back, and she'll just get your information and we'll get you scheduled for that. If you feel that you want something more, if you feel that a balance assessment, a full 1-hour balance assessment is something that you feel that you need, and you're a Medicare person, then you need to get a prescription from Dr. Burkhardt or from one of your family, one of your physicians, because Medicare, you do have to have a prescription to come in for physical therapy. But if you're not a Medicare age, you can come in and actually we can do that kind of assessment. So if anybody is interested in any screens or any evaluations, we're here for you.